At CfPS conference powerfully illustrates what happens to vulnerable patients when those in power don't listen to feedback. What can we do to change that?
Well, I think the first thing is that people need in the health service to listen to the patients. They are a goldmine of information about what's actually going on in the wards, and yet when they complain, the habit is to give them a formulaic answer, a formulaic apology, and life goes on as it was before. The second thing is to listen to the staff. Staff had hundreds of incident reports were filed saying they didn't have enough staff or various other problems, but the staff gave up because no one told them what they were doing about it. And finally, if you get to whistleblowers, you know it's too late, but even then, various whistleblowers told a very accurate picture of what was happening there. There were even reports written about it, but they never got outside the trust. And I think if any of those things had been done correctly, we wouldn't have had the problems, the appalling problems the patients suffer.
Yeah, and really what you're talking about is that all the systems were there, but they didn't work. So really, are we talking about a cultural change? And how do we shift the culture?
Well, I think there are two things. There has been a part of that culture actually has been being satisfied with the fact there was a system in place, and it's all very well having a system, but you've actually got to use it properly. But the second thing is that I believe that everyone who goes to work in a public service needs to think every day, what am I doing that actually benefits the people I'm meant to be serving, that being the operative word. And if people thought about the information they get in that way, I'm sure they would react rather differently to the way that people appear to react around staffing.
Yeah, and what do you expect the NHS and the government to be doing now to take forward your recommendations, and what are they doing now, and is it enough?
Well, understandably it is taking time, because I've made a lot of recommendations quite deliberately, because change is needed in virtually every corner of the system, and some of them are quite complicated. But I think my overall message would be that the people on the ground, people who work on boards of trusts and scrutiny bodies and so on, don't actually need to wait. All they need to do is to act themselves to put the patient's interests first. And if they did that, and listened to what they're being told, and then acted on it, I'm sure things would change very quickly indeed.
Thanks very much for talking to us today.
Pleasure.